Hello, I'm Mira Selva, Director of the Reuters Institute for the Study of Journalism Fellowship Programme, and welcome to the Global Journalism Seminar Series. We're still here, reporting on COVID-19, waiting for lockdown restrictions to end, wondering what society will look like. It's been one of the most disconcerting years for the entire planet, and an unbelievable year for journalism, where we've had to deal with the health beat becoming the most important and quite frequently the only story in town. Today we have with us one of the women who've been at the front line of this reporting. Jessica Hamzelou is a biomedical reporter for the New Scientist magazine. She was named British Society of Magazine Editors Best Digital Writer in 2018 and the Association of British Science Writers British Science Writer of the Year in 2017. She's brought us a really unique perspective on how to report on the coronavirus in the last year. She's a BSc in medical science, and so she brings the expertise needed for this story, but also the storytelling and the understanding of journalism and how to get this important narrative across to audiences. She also went on maternity leave last year, and there's a really interesting discussion to be had here also on the role of women in the pandemic, how they've featured in the narrative and when they've not featured in the narrative. She's going to talk to us today about how the pandemic changed her readership, her reporting, and even her writing, and what she's learned from being on the other side of the reporter-reader line. Jessica, thanks so much for joining us today.
Thank you.
Thank you. And I'll hand it to you for a presentation, and then we'll jump right back in with questions. Thank you.
Great, thanks. Right. Hello, everyone. My name's Jessica Hamzelou. I'm health reporter at New Scientist, as Mira said, and I'll be talking about my experiences in covering the pandemic. About me, I've been a news reporter for 12 years, and I write for New Scientist, which is a weekly international science and technology magazine, and the website. They look like this. This is the magazine, and this is the website, and I cover health and medical science, and in recent years I've focused on things like fertility, genetics, microbiology, neuroscience, but obviously the pandemic comes under that. And as Mira mentioned, I have a science background, so that's been quite useful. It's just a science degree, not a practicing scientist, but that has still been useful in kind of passing the information and making sense of things and reporting on COVID-19 in the past year. And I'm currently on maternity leave. I got about 4 hours sleep last night, so please don't expect too much from me. So my reporting on the coronavirus started in January of 2020. It was I remember because it was one of the first days back after the Christmas break, and my editor had found this report of this mysterious pneumonia that was being reported in China with an unknown cause. This was New Scientist's first coverage of the pandemic before it was a pandemic, on the 7th of January. Because I'd written that first story, I kind of accidentally became the coronavirus reporter for a very, very brief period before everybody in the magazine took it on, basically, because it was such a massive story. I'll try to focus this presentation on the challenges that were specific to reporting on coronavirus in 2020. So things kind of picked up pace later in January, especially the last couple of weeks. We really ramped up our coverage. So the next story was 9th of January, but then all of these were in January. You know, people were dying. Where did the virus come from? The virus is in the UK. How deadly is this virus? How can you protect yourself against the virus? How contagious is it? And at the same time as our output was ramping up, the number of readers we were getting on these stories was increasing massively. So that story on the 9th of January got 2,655 page views within the first 3 days of being published. And then that next story, 21st of January, 8,600. And then it just kept ramping up, almost 55,000 page views, sorry. Little dip there, but then we were into the hundreds of thousands on these stories. And that's really high for a story in New Scientist. So one of my stories in New Scientist, that's kind of up there with my biggest stories I've ever written. And just to kind of give a bit of comparison, I also wrote a story about miscarriage, for example, in that period that had 1,400 157 page views in the first few days, or a story about a machine that repairs livers that got 3,300 page views. So these were really high numbers for us. For some reason, people weren't that interested in the World Health Organization declaring an international health emergency, maybe because it was obvious by then, I'm not sure. So the reporting challenges, I would say that reporting on coronavirus, even though it was a health story, it was a medical science story, it was quite different to any other reporting I've done before. Our kind of typical style of news reporting in New Scientist, for me anyway, I'll typically find a new research finding that's exciting or interesting or hasn't been reported elsewhere, and then write it up for the website. It goes into the magazine for the next issue, and that's it. That's the news story done. It was quite different with coronavirus for quite a few reasons. One of them was that you had to be quite careful that you weren't going to be out of date by the time the story was in the magazine, which could be, the cover date of the magazine could be more than a week after that story's gone online, and a lot that could happen in a week. I mean, the story was just evolving, as we all know, not just on a daily basis, but on an hourly basis, or, even to the minute. So this is an example of a story that we wrote that was published on the 27th of January online, about how contagious the coronavirus was, and we had to update it. As soon as we published it, the number of countries that had been affected by the coronavirus had grown by two or three, I think. So we had to quickly update that story. So that was definitely a challenge. And in the same vein, you don't want to get it wrong, because as I said, the science was coming out all the time, it was evolving all the time, our understanding was changing all the time. It has done a lot, even since I've gone on maternity leave, with things like the role of children in spreading for the virus, for example. But things were changing all the time, so that was definitely a challenge. And the other challenge was, how do we offer something extra? Because everybody was now covering this. This wasn't just a kind of a typical health science story that you might find in a few places. This was a huge, massive global story. Every news outlet was covering it. So how do we offer our readers something extra that they might not be getting elsewhere? So one of the solutions, one of the ways we changed our reporting a little bit, was to kind of take the approach of answering questions. And the idea was to kind of bring some evidence-based clarity at the time of fear, confusion, and misinformation. And I would say even among experts, because at the beginning, nobody really knew what was going to happen. And it's something that I think is really important. It gave a lot of value to our readers, and it's something that we did quite well, because we had that we were able to kind of interrogate the science. And here are some examples of some of the questions. When is it safe to ease lockdown? How many of us have the virus? Herd immunity, has it been achieved? These kinds of things. The questions typically came from kind of a gut sense. What were the questions that we had as people? What we were all living through the pandemic as well, what the questions that we had, but also sometimes the digital editor would say, a lot of people have been searching this term in Google or some search engine. We should probably shed some light on that. So which strain is more deadly? Should we let the coronavirus spread among young people? Children wearing face coverings? Lots of questions. Another challenge is which studies we should cover, because there was just a huge explosion in scientific research among people who typically studied viruses or disease outbreaks, but also other scientists and researchers who were typically not within this field were kind of bending their expertise towards answering questions related to coronavirus and the pandemic. So just as an example, there's one statistic that I found. So between February and May, health and medicine research article submissions to Elsevier, which publishes a lot of this kind of research, increased by 63%. My colleagues at Nature put together this graph, which just shows you how research just exploded in the first few months of 2020. And a lot of these were preprints. The blue line shows preprints, which are studies that haven't been peer reviewed. Typically, when research is done before it's published in a journal, it's kind of assessed by other scientists, and that process is peer review. that doesn't happen with preprints. People do research and they just put it online on a preprint server. And there were just so many of these coming online every day. The two preprint servers, medRxiv and bioRxiv, that we were using, they kind of pooled all of the coronavirus research. And I checked it the other day. So far, there have been over 16,000 articles, which is a lot. And it's harder with these preprint papers because I mean, there are definitely problems with peer review, but there hasn't even been that kind of quality check with preprint papers. So what we did was, to get around this issue, we kind of focused on identifying trends instead of single studies. And partly that's because covering single studies can be problematic anyway, because things are changing, but definitely in a rapidly developing situation, you don't want to give too much weight to one single study when, as we said, things can change. So it made more sense to kind of look at research, where the research was heading, whether there'd be a kind of, for me, I would look for, I try to keep on top of the research, but I'd look for trends, like were there a few studies that were suggesting a kind of similar thing? Was there a theme emerging in one area of research? And that was quite helpful. And the idea is you're less likely to be out of date, and also you're less likely to be proven wrong. And also it felt like that was an approach that might give our readers something they might not get elsewhere, because we can kind of maybe pick out a trend before it's had a lot of pickup elsewhere. And here's one example of that. This was a protein on the surface of cells in the body. Was it involved somehow in predicting whether somebody was more vulnerable to the virus? Because there were I noticed a few studies suggesting that maybe smokers had more of these, or older people had more of these receptors, or people with diabetes had more of these receptors. And in those early days, those were the kind of the only things we would go on that we could tell were putting people at risk of a severe infection. So we looked at that for a story. And another one was if the coronavirus is infecting the brain or getting into the brain somehow, because there'd been a kind of, I'd again seen quite a few studies suggesting that this virus and other virus was getting into the brain or causing kind of neurological symptoms. So that led to a feature on whether the coronavirus affects the brain, and if so, what does that mean for understanding it and treating it? Another challenge was knowing which voices to trust when you're getting comments, or you're seeking input from other scientists on stories, and working out who can give a qualified opinion. And this was actually tricky. It's more challenging than it might seem, because it felt like suddenly everybody had something to say about coronavirus. And if you had a title of doctor or professor, you were given a media platform, even if that wasn't necessarily your area of expertise. So I remember seeing a neuroengineer, for example, commenting on the spread of the virus. Just exactly, and there are many examples of this. This is a kind of well-known one, but this oncologist had a very big media platform, I would say. As I came across his opinions a lot. He was an oncologist, so this wasn't his area of expertise, and he was arguing against lockdowns a lot of the time. And he kind of has developed since this, maybe a lot of people are already aware, this kind of online following of what we might call COVID deniers, who kind of hold him up like, this professor is saying this, so our opinions are valid. So it can be a little bit dangerous to give people a platform when they might not be the best person to give an opinion. And in the same vein, understanding what's a debate and what's a minority opinion. And one of the biggest examples was the debate over, well, it's the same debate really, whether lockdowns are worth doing. There were some scientists, even epidemiologists, arguing that we'd already reached herd immunity early. I think it was in the spring of 2020, that enough people had the virus that we would be protected. We didn't need to institute any other restrictions like lockdowns. And I think that was quite often presented as like, half of research believe this and half of researchers believe that, and that wasn't really the case. So I mean, what helped for me was just talking to a lot of people and getting a better sense, and again, having a science background was a bit helpful with that. And also developing trusting relationships with sources that I'd come to rely on. It was so valuable to have like a few people that you could, even if you weren't going to quote them in the story, just have like a check-in with them, have like a kind of, yeah, regular check-in. What do you think of this? What do you think of that? What do you think about the story that's evolving? Is this really a 50-50 split among experts? So that was really incredibly valuable. There was also more bias than usual among sources. I would say there were some scientists had very strong opinions that weren't always backed by the weight of evidence. And I guess it's because we were all going through the pandemic, we were all affected by it, we were all seeing its impact on loved ones. A lot of us were losing loved ones. And it just, it's one of those situations, it puts a lot of pressure on people. And I kind of understand why people weren't, what's a good way to put this? They weren't following the evidence all of the time. And one good example of this was over the use of face masks. And even though it did, opinion has changed and there's a bit more evidence now, and the general consensus is it's worth wearing a face mask because it does have some impact on the spread of the virus. Early on in the pandemic, that was not clear at all. There was very, very little evidence, and what there was incredibly weak. And a lot of the research that was there was saying they're not really going to do anything. So even though some people were saying we should be wearing face masks, and they did turn out to be right, we can't make that judgment as reporters. We just have to say, well, actually, there isn't actually that much evidence at the moment. So that was a tricky one. And then, as I've mentioned, everything was changing all the time. So that was tricky. A story might have changed overnight, and it also meant that there was not really any final word, which there often isn't in science, but it was really pronounced during the pandemic, because you pitch a story and there wouldn't be a bottom line often, because you don't know the answer. And a lot of our stories, a lot of my stories ended with, we don't really know, it's not really clear. It wasn't satisfying as a reporter to write that, and I'm sure it wasn't satisfying for the readers to read that either. More generally, there's the impact of just covering the pandemic, because we were just covering it, we were obviously living through it. And none of us were as I say, we were losing people, we weren't going out. And for a while, it felt like the only people I was speaking to were scientists, and every phone call just left me feeling incredibly low, because it was just doom, doom, doom. That's how it felt. So it was difficult from a personal perspective. It was really challenging. The general impact, I guess. And there was also a lot more work, because trying to keep up on top of everything it felt like a full-time job in itself. It felt like an impossible task. You'd go to sleep, wake up in the morning, and as we've seen, thousands of research papers would have been published, reports published. What are the case numbers this morning? What's been the impact in this country? Which countries have changed their restrictions? Which ones are proving to be effective? What has everyone else written about it? It was just a huge, huge, huge amount of work just to keep up with what was happening. And in terms of the actual work that I was doing as well, reporting work, the number of stories I wrote doubled compared to the year before. And the stories were also longer, on average, about 100 words longer. But there were a few much longer pieces, more than I had done the previous year. And that's despite stopping work in October. It also felt like there was a lot more at stake when covering the pandemic. I generally feel like there's a lot at stake in journalism generally, in health journalism definitely. I always feel that what I write, somebody could read this and potentially change the way they live their lives. They could change their diet, they could change their behaviors, they could, I don't know, it could have a really big impact on a person. What I've read in other places has had a big impact on me. So I'm always aware of that. But it felt especially pronounced with the coronavirus pandemic, that what people were, hundreds of thousands of people were reading our stories. And if somebody changes their behavior based on what they've read, could that mean that lives are at risk? Could it mean, could it end up in some convoluted way being responsible for putting someone in hospital or worse? So that responsibility did feel enormous, and it would sometimes keep me up at night. I found it quite stressful. I'm sure lots of other people did, but I'll come back to that a bit more later. There was also a lot more feedback generally by email, social media specifically. I am on Twitter a lot, but I don't tweet because I find it a bit much. There are a lot of people with a lot of strong opinions. Oops. I remember once when I was off work, somebody tagged me in a story that I'd written, and I just kept getting notifications on my phone of people commenting, telling me how I was wrong, and it was just a lot to deal with. I found that stressful, that you couldn't get away from it almost. Here's just I just found one story. I picked up one random story on Facebook that I written. Here are some of the comments. Don't believe a word, trying to scare us all into agreeing to vaccinations. More propaganda from New Scientist. More like rigged propaganda for an agenda, unfollowing, etc., etc. There was plenty of this, and there's been much worse. And I know a lot of other journalists have had it much worse than this, especially people who are prominent on social media, and I'm not. So I've had it mildly. The other thing was that I mean, we've mentioned this no answers and it being unsatisfying, but I feel like there was almost something a bit more to it, like just knowing the uncertainty it can kind of eat away at you a little bit. And I don't know how much of that is reporting on it or just, living through very uncertain times, which we were all doing. But it was a lot. I found it a lot to cope with. Here's an example of the reporting. No one knows why. Questions unanswered. It isn't clear. It's very, very typical of the kind of reporting I was doing throughout the pandemic. The other thing that I found quite intense and stressful was that science was ignored. So from the beginning of the pandemic, the scientists I was interviewing had made a few very key points. The importance of testing people, for example, the importance of early, swift and definitive interventions like lockdowns, for example, when they're needed, the role of potential super spreader events. They were all things that people were flagging, that scientists were flagging from the very beginning. And I felt that when it appeared that they weren't being listened to and their advice wasn't being heeded and their recommendations weren't being implemented, you end up just coming back to these scientists again and again over the course of 10 months for me, but much longer for other people. And they're still saying the same thing. They're still making the same points. And you feel like, what's the point? It's like banging your head against a brick wall. You keep saying the same thing and nothing's changing. It was annoying as a reporter. I imagine it was much worse for scientists. And when I asked them how they felt about it, they would tell me off the record. That's when all the expletives would come out, that, effing and blinding, I can't deal with this, blah, 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 blah. And I don't blame them at all. It's really taken its toll. The other thing is the inability to switch off, which I think is just really important. All the mental health advice that I read and I was told was, you need to take a break from things. When it's getting too much, you need to take a break. You just switch off. And you can't do that when you're covering a story as big as this, because it's evolving all the time, because there's always something happening. Even if you switch off for a day, it feels like it can sometimes feel like you've missed weeks in a kind of a story developing at a normal pace. So that was also really difficult. And I can talk about my personal experience. This does have an impact on mental health, and it had an impact on my mental health and my well-being. So I became pregnant in February 2020. So I was pregnant, what I felt like throughout the whole of my reporting on the pandemic. And I became quite unwell with anxiety and depression over that time. And it's hard to know what to blame it on, because there was obviously so much happening, the pandemic, the reporting. I had quite a tough pregnancy. I had my 2-year, well, she was 1.5 at the start of the pandemic. She's now about to turn 3. but she was at home as well. So it was pretty intense. From when nurseries closed in March, my partner and I were kind of tag teaming childcare throughout the day. So I'd start work at about 6:30, 7 o'clock in the morning, and I'd finish around 11 p.m. And that was with doing a bit of work, looking after my daughter, preparing a meal, going back for a meeting, doing some phone calls, doing something else. My partner said, I've got a meeting, so we'd have to swap it over. And we were the lucky ones, because I realized we were able to work from home. We were able to, I think we might have avoided getting the virus. I don't want to touch wood because I've only had one dose of my vaccine. But it was still really difficult and a really intense time. We lost a lot of income as well. My partner lost more than half his income. I had a 10% pay cut. We were expected to continue paying nursery fees. So it's just, there was just a lot going on. And with the COVID reporting as well, it was quite an intense time. So I felt sick all the time, couldn't sleep, all the kinds of things you'd expect. I was signed off work by a doctor twice. And it was just a really difficult time. And it's only recently, since actually when I was doing a bit of reading around preparing this presentation, that I've read reports and articles suggesting that this was really not a unique experience, which totally makes sense. This article by former Daily Beast journalist Olivia Messer is worth reading. She quit her job as COVID reporter, and she, in this piece, refers to a lot of other journalists that did the same, because they just found it really difficult to cope with it. They didn't have the tools they needed to cope with reporting on such a devastating and massive story. Sorry. In that piece, she mentions a lot of the challenges that I've referred to in previous slides. There's also been a handful of studies into this now, one of which was authored by Mira Selva and her colleague. And in that study, I'm sure Mira can obviously tell you much more about it than me, but one of the findings was that 70% of the journalists that responded to the survey said that they had some kind of psychological distress. And there are lots of other studies out there saying the same thing. And I'm including this picture because I think it kind of, not most flattering, gets across the kind of extreme exhaustion I was feeling by that point. Obviously part of it was having given birth, but it was quite a year. So I left to start my maternity leave at the end of October. I stopped working, haven't reported on the coronavirus since then. And I also, when I left maternity leave, I did decide to switch off, and it has been hugely helpful. So I still get my copy of New Scientist through the post every week, and they are fantastic. And my colleagues have been doing an absolutely amazing job in covering the coronavirus and every other field of science. But I have let them just pile up for a bit, because I've found it so important for my sanity just to stop just to stop reading about coronavirus for a while. I very much recommend it to anyone else who's feeling a bit overwhelmed. It's done wonders for me. And also I've just been recovering, so focusing on small tasks, getting outside, the kinds of things that you're recommended to do, but you might find difficult when you're reporting. And the other thing I've been doing is consuming, I'd say, much more variety of media. When I was reporting on coronavirus, it was just all COVID all the time, and it is just not healthy. And now I'm kind of enjoying just kind of listening to music on the radio for a while, maybe, or reading a parenting book. It's not just something that's not coronavirus. Even when I do read the news, it's much more varied now. I think maybe that news coverage is more varied as well. There is more out there. It did feel for a while that it was just coronavirus. That was the only story. And it's just so much better to have more variety. So much better for my well-being, and I'm sure for everyone else as well. I did eventually start missing reporting. Just having that kind of insight that you get when you're reporting, getting all the details, speaking to scientists. I do miss that, but it did take several months to get to that point, and I'm still happy to be on maternity leave. I've also had time to kind of ruminate on the whole experience and what it was like. I wish I had something more insightful to say, but I just hope that as this kind of research comes out now and people are more open about their experiences, that from like a journalism perspective, that employers are a bit more supportive, just generally, not specifically to me, but to everybody, that employers can be a bit more understanding and supportive to people for having a tough time. And also, I think there's a lot to be said for checking in with each other. There are a couple of my workmates who kept in touch with me, who checked in on me when I said I was having a hard time. That meant the absolute world to me. That was so wonderful, and it really kept me going. So I'd say that's probably an easiest solution in the short term. So that would be my kind of positive note that I'd like to end on with this presentation. Thank you.
Thank you so much. Thank you so much, Jessica. Really moving presentation, insightful. And thank you for showing the picture of you with your lovely baby. You look absolutely gorgeous, and your baby's face seems to be showing all the fury of the last year. But congratulations, really lovely. On mental health, you're absolutely right. And this study that you referenced that I did with Professor Anthony Feinstein actually surveyed journalists at the beginning of the pandemic. So this was a survey that we did with journalists who'd only been reporting for a few months at that stage on the pandemic, and it was already showing signs of visible distress. And what was very clear there is that the ones who had been offered counselling or received counselling or mental health support from their employers were in a significantly better state than those who didn't. And part of the reason we pushed that study out quite early is to send exactly that message to employers that firstly, journalists are suffering, but also there are very clear things that can be done to help. It's not one of those situations where you need to throw your hands up in the air and say, it's a tough time for everyone, what can we do? There are very specific measures that can be taken, checking in on people, offering services, except, recognizing the unbelievable pressures people are working under right now, allowing flexibility and kindness, they will make a massive difference. So thank you very much. I'll bring some questions, and do please type in your questions into the Q&A box, and I'll put them to you. One question that I really wanted to know is, how do you feel COVID-19 has changed health reporting? You mentioned a few things. You mentioned the heavier reliance on preprints and the lack of peer reviews, and then the issues around trust and the issues around the fact that anybody with a professor or doctor in the title being given a platform. Do you think these are things that will stay with us in all aspects of journalism, or do you think it's something that will kind of disappear, hopefully, as the pandemic eases?
Well, I do hope some of those problems will disappear. I think in terms of how our reporting changed, well, my reporting changed, I can't speak for other people, in terms of how my reporting changed, it was quite nice in a way to actually take a different approach to finding stories and writing stories and telling stories. And I hope that I'll be able to continue having that kind of diversity in my reporting. Yeah, and the other thing that I noticed, and maybe it's just because maybe this was always there and I only just noticed it because I was paying more attention to coronavirus, is I felt that there were a lot of ways of covering the health beat that really flourished during the pandemic. It wasn't just the case that if you weren't a health reporter, you had to kind of jump in the deep end and cover the virology or something quite complicated like the virus of genetics or something like that. There were so many ways of applying so many various types of expertise to what was essentially a health story. And I really hope that health stories still kind of get that level of attention.
Could you talk, that was my next question actually, could you talk a little bit more about that? What storytelling formats worked and where the innovations were there?
In terms of format, our storytelling format, my storytelling format didn't really change. I enjoyed seeing the way that other publications told the story. There were some amazing data visualizations, which I'm sure everyone's still seen in, for example, sorry, El País and New York Times showing how the virus can spread through different settings, an airplane, a school, a pub, I think, or a bar or something. Our format didn't really change. The thing that I was kind of thinking of is more the kind of I'm thinking more kind of investigative journalists putting their talents into telling different aspects of the story that we wouldn't cover at New Scientist, but I really appreciated the fact that they were being told by other people, like, for example, the fall of the CDC. That was amazing reporting that was happening across so many publications. Cronyism in governments, things like that kind of thing. I just, like I said, maybe I'm just noticing it because it was applied to the story that I was very focused on, but it was really nice to see this health story being explored from so many different angles.
Absolutely, thank you. I'm going to go to the questions and talk of trusted sources, and a question from Jacob Krupa, a journalist fellow from Poland, saying, firstly, massive thanks for your work, been a huge fan of New Scientist and subscribed during the pandemic. And sorry to hear about the impact of COVID, including on mental health. To what extent have these voices of random doctors, professors of economics, sociology, other assorted specialisms intervening in the COVID debate with the kind of "I'm a professor, trust me" line made it more difficult for you to make people trust and follow your reporting instead of basically being able to seek out the narratives they wanted to believe? And what did you find worked as a way to kind of counter that narrative?
I'm just going to make a note so I don't forget the question. So, I mean, you often get that kind of, I don't want to apply it to this situation, but generally there's often there are people out there who are kind of anti-science, I would say, or anti-vaccination or climate change deniers, that we find this kind of, we get this kind of backlash to stories, no matter what we cover at New Scientist. We get it quite often from a small group of people. So I'm not sure if this made it more challenging for us because we're used to kind of experiencing that. But I do think it was just dangerous generally, because it gave people, because as we said, there's so much misinformation out there. And for somebody who is maybe not seeing the impact of the coronavirus and is getting some kind of weird story, weird narrative pushed to them on social media from something that's not a news source, from goodness knows where. And then a professor comes out and says, whatever they're saying, no, we shouldn't lock down, is detrimental. Of course it did have detrimental effects, and nothing's ever black and white. But it's dangerous because it gives people something to kind of hook an uncertainty onto. It feels like a valid opinion, it feels like a valid point, and it kind of creates this fake assumption that there's two camps of opinion when there isn't. So I don't know if it directly affected my reporting, although maybe it did, because we did have to. I felt like once these debates became widespread enough, I did feel like we have to address them. We were addressing readers' questions, and this was a question. That's why we wrote that story about, have we reached herd immunity? I mean, if people hadn't been saying, yeah, we've reached herd immunity without really any evidence, then we wouldn't have written that story. So it did kind of affect our reporting. And there was also a bit of a challenge, actually, I found personally when I was writing that story. I remember having a conversation with my editor, and I said, well, obviously we haven't reached herd immunity, and I can easily find lots of scientists saying we haven't reached herd immunity, because that's what most of them are saying. And he said, well, we can't just put down the opinion of this group of scientists without including their voice. And I was kind of like, do I really I don't want to give these people more airtime, but you do kind of, I don't know, the editorial decision in the end was we should at least talk to them, ask them their reasoning, and include it in the piece, even if our conclusion is that no, that's not the case. So that yeah, it did influence our reporting, and I guess that's how we countered it.
And this is the both sides form of reporting that can often cause quite a lot of damage, because people don't always read the caveats and disclaimers and conclusion. They just see
exactly.
Listen to it. I mean, kind of related question from Jenny Kangesniemi from Finland, who also works as a health editor, and she's saying when she reported on the pandemic, she often struggled with the fact that the readers don't understand the meaning of terms like meta-analysis and peer review, and didn't really understand how you report on studies. And has that been a challenge for you? And how much time do you spend communicating with your audiences the nature of the study and kind of outlining the research landscape?
It's probably slightly different for New Scientists, because we cover scientific research all the time. So we do explain terms that a layperson wouldn't typically understand, but there is a kind of base level of understanding that's assumed from our readers. It's not very high, but like yeah, we kind of expect them to know the very basics of research. So I think new scientists might be a bit of a special case here, although we did explain terms like that.
Yeah,
and they weren't clear.
Yeah, thank you. And also you raised the very, very important point of reporting uncertainty, that this is what we know and actually there's a lot that we don't know, and to expressly say that. And question from Zoe Ramusho in South Africa. You mentioned how ending many of your articles ending with "this is all we know for now" is really frustrating. And since the facts and information on the virus were changing constantly, did you ever report on something that was then proven to be absolutely incorrect? And if so, how do you deal with that in the newsroom? And you write a follow-up, what do you do with the story? Yeah,
there are a few things that have definitely changed. The face masks thing is one of them. The face mask, at the beginning, I evaluated the research. I spoke to scientists, and the conclusion was there's not really any evidence that it worked, and they worked to prevent the spread of coronavirus. And then also more recently, as I'm seeing more evidence that children play a role in the virus spread, which when I reported on it, I think it was back in September, sorry. The idea, the general consensus was that children aren't playing that much of a role in the virus's spread. So these things have changed. I kind of feel like I've had a bit of a kind of cheeky escape from having to deal with that because I've gone on maternity leave. So I haven't had to correct any of my stories, but it's one of those things. I think there was an editorial decision made early on that we weren't going to just keep updating stories. It would just be a case of publishing something new, because you can't just keep changing what you've done and say like this has been changed for this reason.
In your archives, it kind of stays as it is, but with the date to show that.
Exactly. So I'm not sure how other people, I think that, but there's only so much you can do, isn't there? Because you're just going on what the information that you have at the time. And as I said in the presentation, we as journalists, we can't kind of make assumptions or make predictions. We just have to say, this is what we know, this is the evidence, this is all we can say for now.
Thank you. And as well as kind of the facts changing on, or the evidence changing on this, there's a question from Peter Adeli from Hungary. There's quite a heated debate around the origins of the virus, and this has huge geopolitical implications. And all the way through, this has been a science story with massive national agendas and narratives. And how do you deal with this as a science reporter primarily, you know, when you're the British government speaking about using a certain type of language and the French government using a different kind of language, for example? And what do you think about the early coverage of this specific topic and where we are now? This is to do with the origins of the virus and who's to blame ultimately, which is what this comes down to.
Mm-hmm. Okay, there's a few different things that I can say about that. So, in terms of okay, let's start with the covering things from organizations that we might have been expected to trust. Governments, I don't know if you'd been expected to trust them, but also I have been really shocked throughout the pandemic that this is one thing that surprised me. The evolution of the story hasn't really surprised me. One thing that has surprised me is some of the messaging that's come from organizational bodies that you'd really expect to be able to trust about science. For example, the CDC, the FDA, who were just getting things wrong, and their messaging wasn't based in evidence because obviously there was a lot of political pressure. So that was something that we had to kind of learn early on, that you can't trust, you can't get you weren't getting a final word anywhere, but you definitely couldn't get a final word from the CDC or the FDA or one of those bodies. In terms of the source of the virus, I find this all quite, again, I do find this quite surprising, the way this story has suddenly come back and taken a bit of a turn. I don't really, I guess there are non-scientific reasons why this lab leak theory has suddenly gained so much prominence all of a sudden. If you think about it from a scientific perspective, it's just another potential source that's worth investigating. But the way that's become such a big story, I've also found a bit surprising. I guess these things can just kind of run away. And what was the other aspect of the question? Sorry, what was the other part of the question?
How do you deal with such a politically charged story as a science reporter?
Yeah, again, I feel like we're in quite as science reporters, we're in quite a privileged position because we can always turn to the science, even though the science can, I mean, you do have to be aware that, you know, people who are doing this research might have an agenda. I guess it comes back to having the people that you really trust, having a handful of scientists. For me, this was what was so valuable, having a handful of scientists that I really trusted, follow the science, that I could just go back and have a quick sense check with them. Like, am I along the right thing? I'm not getting confused by anything. I'm not being misled by anything. And also just trying to be aware when you find research, you can see where you can sometimes see the scientists should publish their conflicts of interest, and just try and get a sense. I always do like a quick Google if someone's saying something that seems that's kind of making me raise my eyebrows. I would just do a quick Google and make sure they're not affiliated with some institution that might be, you know, might have some kind of heavy political influence or something like that. But that's how I approached it.
I mean, this is definitely true in the UK, and the US, but also certainly in other countries, India, Brazil, where official data on deaths, which are still rising, is virtually hard to come by. And there's a question from a few journalists, but from Shweta in India saying, what kind of advice would you give on how do you know, what do you do as a journalist when you're reporting in an environment where there's so much contradictory information, much of it unreliable? And do you have to, you know, do you have to second source it with government data, or can you use crowdsourcing? You know, where do you get the numbers from? Yeah.
I'm probably not the best person to answer that question because I didn't do any kind of investigative stuff to find my own numbers. So a lot of it was just kind of relying on what was out there, but including huge, great caveats, because I felt that was all I could do at the time. You know, we were reporting on these figures because for me, that was all that was out there. And then you speak to a lot of people and you have to kind of, I guess that's a story in itself. Like, how much can we trust these numbers? Maybe we can't. I'm pretty sure New Scientist ran a story like that. I'm sure there have been lots of stories saying that, you know, these stories aren't reliable for these reasons. These figures aren't reliable for these reasons. And sometimes that's just the best you can do.
Yeah, I mean, what sources would you recommend that journalists outside the UK look at for research on the pandemic? Would it be from the WHO, the UN? You know, where would you?
Oh, I don't know. My approach was to kind of look at a few different sources, look as kind of as many, and it's probably not the best use of a person's time, but for me, I look at kind of a few different sources, look at as many as I could find, speak to scientists and say, where are you getting your data from? What do you think is this reliable? And then just at least you have a sense of what's out there. I didn't come across one source of information that I just pinned all of my trust on and said, this is what I'm going on. You can't, for me personally, that worked out well for me to just kind of hedge my bets a bit, speak to people and figure out, like, yeah, how much trust you can put in them.
I think this is, again, it's on reporting uncertainty and being open with readers that even the research and the data is not 100% accurate, but to explain it's the best, you know, it's the best guess in a difficult situation. Mm-hmm. Question from Francisca from Indonesia. You talked about social media, and you don't have that much of a presence on social media, and other people do. And we have seen in a lot of countries doctors going on social media directly to try and kind of get information out there of what it's like on the wards, to warn people of how serious it is. And they're often very impactful and they gain a lot of followers. What do you think about this? On one hand, it's kind of a good way of fighting false information, but it's also prone to be, you know, manipulated. And do you think it undermines the role of the health reporter as a gatekeeper to this information?
I don't think it undermines the role of the health reporter at all. I personally found it really valuable to see those kinds of stories online from doctors, for example. And also there are a handful of scientists and doctors that I follow on Twitter that have been so informative during the pandemic, coming up with these amazing threads explaining what's happening in various places in the world and whether we can trust certain numbers or what's happening to the virus as it is evolving. You've heard this headline, this is what the evidence says. There are a handful of doctors and scientists doing such an amazing job on it. I think it's a good thing. Personally, I think it's an excellent use of social media.
And how do you deal with kind of pseudoscience, the wellness influencers, sometimes people with professional degrees spreading misinformation about COVID? And Bermak Talant, who's from Kyrgyzstan, and was a reporter in the Ukraine, said there was a high level of vaccine hesitancy amongst doctors who are also then promoting alternative therapies. What do you do in these kind of scenarios? Do you ignore it, or do you try and report on them to debunk?
I think you have to be really careful when it comes to debunking, because I'm pretty sure that there's research behind this, that you don't want to be giving more airtime to a theory. Even if you are debunking it, you're still kind of bringing it up. You're still, giving it some airtime. You're still, I mean, you might be introducing it to a whole new audience. If we were to cover some kind of pseudoscientific theory in New Scientist, then there might be a whole raft of readers who hadn't thought about this, who hadn't heard of it, and suddenly saying, "Oh, hang on, what's that?" And then doing some research, and goodness knows what happens. So I personally think that unless something is so massive that there's a real kind of public need to dispel some kind of myth, just stay away from it and ignore it, because you don't want to be giving people a megaphone, and you want to be taking it away from them.
Yeah.
Or not, but just leaving it.
Thank you. And just, just in the last minutes, just going back to the kind of very pertinent points you raised about well-being and professional self-care in these scenarios. Do you think this has changed the way you'll approach work generally when you do go back to work? Or do you think this was kind of an emergency situation?
I hope so. It's funny. It's amazing what just taking a complete break. So I've only experienced this when I've been on maternity leave. For some reason, when you go on holiday, when I've been on holiday, you don't really get the same kind of distance. But going on maternity leave, you are kind of forced to stop, because suddenly there's a tiny human that needs all your attention. And it's really amazing the way it changes the way you think about work. I remember the first time I went on maternity leave with my first daughter. Before I left, I was kind of ramping everything up and trying to get as much done as I could, and saying, no, I'll do that. I'll don't worry, I'll just carry on. Just call me when I'm on maternity leave. It's fine. I'll finish it off. It's fine. And then suddenly, when she was born, I was thinking, why did I put so much of my, why was I prioritizing this magazine? It's a magazine. It'll be fine. It can cope without me. And just being able to focus on something else. For some reason, I feel like, I don't know what it is about journalism. It's very fast paced. It's very competitive. You always need to be proving yourself. You're only as good as your last byline, I feel. And it's only when you have that complete break, you're like, no, there are other things that are as important. And that includes all of our well-being. So I hope that when I go back to work, I'll just remember that like, yes, it's important what I'm doing. It's very important. I really enjoy it. I love it. It's great. It's brilliant. But also there are other things that are just as important, or more important.
You talked about going from being a reporter to a reader, which is what you are now, and you are a reader with a small baby at home, and like you said, a policy, a government that really forgot the existence of working women and women who gave birth, have had a kind of tremendously difficult time in the last year. Do you feel, when you look at the reporting of the kind of the social impact of the pandemic, that the stories, your voices, the stories of women like you, are being recognized or heard?
I hope they are. I've been noticing it more recently. In terms of women and new mothers, there have been some organizations that have been doing an amazing job, like Pregnant and Screwed, and the hashtag But Not Maternity campaign has been doing an amazing job. But then still, like, they make recommendations to government, and they're not implemented. So I don't know how much of an impact that's having. Sorry. It was really frustrating, especially when you're kind of aware of the science, that, when I was pregnant, for example, my partner was allowed to go to the pub and meet his friends for a drink, but he wasn't allowed to come to any of the pregnancy scans, which it's just, it was very frustrating. And it was very upsetting. I hope that those experiences are being considered a bit more now. It's probably a bit late in the day.
No, I hope that what's left of your maternity leave is wonderful and restful, and you have the sunshine now, and you deserve every minute with your new baby and your daughter. Thank you so much, Jessica, for your time and for your honesty here, and for your work, crucially, during the pandemic. The New Scientist was absolutely kind of beacon of clarity and calmness in the reporting, and we were very, very glad you were there. So thank you for your time.
I should also say that I'm very lucky. I'm part of an incredible team at New Scientist. all of my colleagues are absolutely fantastic, and they've done such an incredible job. And yeah, they, as you know, they deserve to share some of that praise.
Absolutely, and it's a magazine well worth subscribing to. But the print and digital site, do work incredibly hard to stay on top of the story. Thank you again.
Thank you very much.
Thank you. And next week we're looking at Belarus and the situation for journalists there, which is absolutely dire. In the space of 3 months, Belarusian foreign journalists were arrested more than 310 times in the line of duty. And as of April 2021, 12 journalists remain behind bars, including Roman Protasevich, whose Ryanair flight was diverted last month in a quite incredible act of airspace espionage. Do join us. We're speaking to Volga Syachevich, a legal expert and human rights campaigner for the Belarus Association of Journalists, who'll talk more about the current climate and what the international journalism community can do about it. In the meantime, Jessica, thank you so much for your time, and thank you all for your questions as well.
Thank you.
Thank you.